All right, if you haven't already watched my first video about my first DNC and my partial molar pregnancy, I recommend jumping over there really quick and watching that. This is sort of part 2 of that, the story of my needing a second DNC. So normally after your first DNC for a molar pregnancy of any sort, the ideal state is that your HCG hormone, starts dropping continuously week over week and eventually reaches negative after a certain period of time. There are certain scenarios where if that doesn't happen, more drastic measures have to be taken. So unfortunately, we ended up falling into that boat. So a week after my initial DNC, my HCG fell to 2,609. And we felt really good about that. That was a pretty substantial drop from what we had the day of the surgery. I think it was like 67,000. So that, was great progress to be making. We would then continue to have weekly checks until I reached all the way to negative. So a week later, right before Christmas on December 22nd, I had a check. And at this point, I will say I started feeling like my body was telling me something wasn't right. I started getting migraines, sort of similar to hormonal migraines that I've had in the past. And I started feeling a little bit nauseous again. And my boobs were really hurting. They were really sore, similar to what they are in like an early pregnancy. So my body was sort of sending me these indicators that something might be going on here. And so December 22nd, my blood draw result jumped up from that 2.6 thousand to 3,555. So at that point, my numbers had increased, which is what you don't want to see. And my doctor at that point, my OB, was a little bit concerned. She said we would test again in a little bit, but she started, having the conversations with me about what this could mean. And this is, very scary, let alone, around the holidays. But with this sort of scenario, I started reading, I had already read things online, but I started diving more into what happens in these cases. And what I was really seeing with molar pregnancies is, chemotherapy treatments start to be talked about to try and stop the abnormal cell growth. And then there was also talk of a second DNC that I saw in some cases. So I was definitely really nervous about that. And my doctor was, my OB, was very aggressive. She wanted to make sure that we weren't lingering on this, that she was being as proactive as she could. So I had another blood draw just after Christmas because of the holidays. The dates were a little wonky. On the 27th, that had jumped up from that 3,000 number to 4,273. So not exponentially growing, but the tissue was starting to grow back and my numbers were increasing. So at that point, she decided to do a few additional checks. I had another ultrasound to look for new tissue, and then I also had a chest x-ray at that point to make sure that nothing had metastasized in me. I guess if that tissue growth becomes cancerous, they most frequently see it appear, I think, in the lungs first. So that was very, very scary. Suddenly being thrust into all of this after thinking that, DNC number 1 was going to solve everything. And my, OB, she was very confident that the first DNC got everything out. It was ultrasound guided, and she was like, everything was gone. It looked really clear. So this was, I think, disappointing for both of us to see. So at that point, my chest x-ray came back clear, which was a sigh of relief that if this had spun cancerous, it hadn't spread. And so at this point, my OB then referred us to a gynecologic oncologist. And it's really interesting how your mind sort of details little things about those traumatic moments. When we got that call from her, I still vividly remember we were like going to Petco and we were sitting in the parking lot. And it was a really rainy, cold day. And I just remember the nurse that I was talking to, trying not to scare me, but having to explain that we were being referred to gynecologic oncology through a different medical center, because at this point we needed to be handed off and sort of given special treatment. So there was a lot of fear and there was a lot of uncertainty around all of that. And, this was happening right around Christmas. So, at the same time, we were trying to get scheduled and talking with doctors, and the new gynecologic oncologist that we were referred to, we had a phone call with him because we couldn't get a, appointment. It was a holiday break for everybody. So it was a lot. It was a lot at once. And it was, it went from thinking we were in the clear to something really scary really fast. So at that point, over that Christmas break, those results, all of my previous results were sent to my new gynecologic oncologist, and we were scheduled for a second DNC after talking with him. So the options here are really, second DNC, see if you can get that tissue to stop growing, or go the chemotherapy route. And he was really confident that because of my age, because of my health, and what he'd seen with my numbers, he felt like a second DNC would stop the growth. Now, of course, I was researching this. There are concerns with things like Asherman syndrome, where sometimes the second DNC can, cause scarring and scar tissue and future issues getting pregnant. So that was something I was concerned about, and I voiced that to him. And he did say, chemotherapy can lead to those same things as well. So he felt really confident. My husband and I also found a medical journal or scholarly article of some sort that was explaining the success chance with a second DNC for molar pregnancies. And you were more likely to have success with it if you were within a certain age range. And there were a lot of, details around it. So I'll try to find that study and link it because it had pretty high success rates for people that fell within those parameters. So we felt really confident that a second DNC was the best decision for us versus trying to jump into chemotherapy that, that could go on for months, and it's just as damaging, if not more, to the body with a lot of lingering impacts. So some women at this point with their numbers rise, they might be, recommended straight to chemotherapy. There's a lot of factors that go into it, especially the rates of, how quickly your levels are rising. So we went for second DNC on January 5th, and this one was much more intense than the first one that I experienced. And I think I almost sort of went into it a little bit cocky because, the first one, the recovery was fairly easy for me and pretty straightforward and wasn't as bad as what I anticipated. And this one was quite the doozy. So day of, this, the standards in terms of getting ready for surgery were the same as my previous one. So if you go watch video 1, you'll see some of those things that I talk about. One thing that was a little odd was that at one point I had a nurse come up and ask me, she said, "Wait, are you pregnant? The lab is confused about some of the orders that have been placed." And I didn't know how to answer that because, technically no, there's no viable fetus, but, by HCG measures, I do show up pregnant. If I took a pregnancy test, you look pregnant. So I was like, I have a molar pregnancy, and I guess that sorted out the details with the lab, but I thought it was a little odd that a nurse was asking me if I was pregnant for blood work stuff. But other than that, this hospital, we were referred to a really prominent hospital, and they were, experts at what they do, and they moved quickly. When we got in there, they had an enormous team of people helping us. They moved us through much faster than we thought, so fast that my mom was coming to the hospital to be with us before I went back, and they moved us so quickly that she didn't even get to see me. So that was nice, and that I didn't have a lot of time to get anxious about it. But at the same time, I think my husband and I were both very surprised at how quick we moved. So at this point, I wasn't as nauseous as I was with my first DNC, which was great because the pregnancy hormones were a little bit lower at this point. But what I didn't realize was that I would be intubated for this one, and that took quite a toll on my body. Maybe I just have a really small airway, but when I woke up from the surgery, I felt like I could barely talk, and then I was so scratched up down my throat. When I looked in the mirror, I had all sorts of like scrapes and cuts and bumps from being intubated. So I really wasn't expecting that because for the first DNC, I had a mask that was, supplying me with the oxygen and stuff. And I know that I had to be intubated for this DNC because it was more intense. They made sure to, review with me the risk of hemorrhaging, risk of hysterectomy if something went wrong. So I completely understand why being intubated is important, but I think it's good to know, if you're having that or not, because you might want to prepare to just, have a scratchy throat, not be able to talk well. And I think I coughed for like a week or two afterwards just because it was so inflamed. So everything else was pretty standard in terms of the prep. Afterwards was a bit more intense than the last D&C for me as well. So you're brought into a recovery space, and I was in this recovery space for longer than I was with the first D&C, and I was in that space alone, which I think was really difficult. So I think I was back there for maybe 45 minutes after waking up alone, and that was really tough. I was shaking because I was really cold. I was cramping a lot more after this D&C than I was with the first one. And I think what was really hard was I was bleeding a lot more. So, that I had a nurse there, and I told her at one point, like, hey, I feel like I'm like sitting in a pool of my own blood. And so she had to keep checking me to make sure that I wasn't bleeding too heavily. Bleeding is normal, but at the same time, when you're sitting there just in a hospital gown all alone, that's tough. It's really tough emotionally, and it's scary, and you feel really vulnerable. So I think this time around was much, much harder just because of that. I also had the same issue I had from D&C number 1, where I was very hydrated afterwards, and I had to use the restroom pretty quickly. So I actually needed 2 nurses to help me that time because I wasn't as stable as I was from D&C number 1. I'm guessing it's because I was put under for a little bit longer for my second one. So I had to have the 2 of them help me. And that was, tough just in terms of going through that, and you're bleeding a good amount while you're trying to, go to the restroom. So I was worried about getting blood on things because for some reason they didn't want to give me any sort of like medical underwear yet. I think because they have to monitor how much my blood loss is and how bad it is. So just know that you will be monitored for that. It's very important and it has to happen, but you'll feel pretty vulnerable probably. And that was sort of the hardest, most unexpected thing for me. However, I did get my ginger ale again, and I was pretty happy about that. That's my drink of choice coming out of surgeries. So after about 45 minutes, I was then taken to an actual room, and then that's where my family was brought in as well. So I was feeling a lot better at that point. The bleeding had started slowing down, but I was still cramping. So all around, I was still fairly uncomfortable, and I was just, I would say, a little bit loopier than I was with the first D&C. I just felt a little bit more out of it. So recovery definitely took longer. I think it took me probably a solid week or 2 to start feeling totally like myself again, from D&C number 2. So the hope at that point is that with my weekly checks, we eventually see me finally reach negative after the first D&C. So my first check was then January 17th, and my numbers finally fell down to 29.6. I will also mention they took my numbers the day of the surgery, but after the surgery, I guess they sometimes like to take them before and right after just to see if there's been a drop. So I fell to 29.6, and during the second D&C, they said that they got out sort of like a grape-sized piece of tissue. So we were pretty confident that the numbers should drop and continue to drop. The week after that, on January 24th, I fell down to 7.4, which was awesome. That was the first time I had been that low in months, and it felt like I was really, really close. At this point, there was a bit of confusion on what I had to get down to. When I called the staff, I wasn't sure if I had to get all the way to 0 or if there was some threshold that being under was fine. One nurse told me it had to get to 0. So in the subsequent weeks, I was pretty frustrated when I wasn't hitting that. I ended up getting clarity from my doctor's staff, and they actually said, no, you don't have to get to 0. We typically like to see you under 5 and holding under 5. So I guess every woman naturally has some level of HCG that's just nominal. So getting to 0 or being able to measure that's pretty difficult. So then on January 31st, I fell down to 3.7, and then February 7th, I fell to 2.7. So both of those were considered normalized ranges. From there, once I hit those values, my doctor wanted to monitor me for 6 months. So some women have monthly checks. My doctor in this case was comfortable doing every 3 months. So I just had my third month check, and that was still normalized. It was a nominal amount that they couldn't measure. And then I'll have another check in 3 months as well. So that period of weekly checks after the DNC is pretty stressful, especially for me, having gone through one DNC where the first week looked okay, and then week 2 my numbers jumped back up. I had a lot of anxiety around my numbers potentially going back up. So I was really happy that second draw when we saw things continue to fall. I'm really confident that, DNC number 2 finally ended this experience for us. So from here, hopefully our 6-month check will be clear as well, and then we will be cleared to try and conceive again. It's very, very rare that your numbers get all the way to 0 and have a recurrence, but it does happen. So I would encourage women, if you're in this process, make sure that you stick to whatever cadence of checks your doctor wants for you. It's really important to make sure that your body successfully completely reaches 0 and is completely healthy. I think that's really everything that we had associated with DNC number 2. I might make another video on just what I'm, doing and preparing for with looking towards a future pregnancy, because I have experienced 2 losses at this point. We're proactively trying to, be as healthy as we can and do all of the things we can, and also rule out chance of some of, these things going wrong in the future as well. So I might talk about some of those actions that we're taking, but that is really the summary of DNC number 2. And I will put some links in the description as well for items that I found helpful in that study as well.